Welcome to For the Good of Man podcast, your trusted source for real conversations and expert insights into men's health. In this episode, we're answering the questions that many men have but few feel comfortable asking about penile implants. Whether you're considering this option for erectile dysfunction or just looking to understand more about what it involves, this episode is here to inform and empower you. Joining us today is Dr. Gregory Amend, a board-certified urologist who specializes in erectile dysfunction treatments including penile implants. He'll help break down the procedure, candidly address patient concerns, and share what men can expect before, during, and after the surgery. We're also going to be joined by Bob, a patient educator and implant recipient himself. Bob brings a unique and personal perspective to this topic, as he himself has walked through this journey, and he now dedicates his free time to helping other men feel informed, supported, and confident in their own decisions. If you've ever had questions about implants, recovery, sensation, or long-term outcomes, you're in the right place. So let's dive into this honest and expert-led discussion about penile implants. To start us off, since we're talking about advanced ED treatments tonight, our first question is going to be, if one has BPH or prostate cancer that may require a surgery, should that be done prior to having an implant placement?
Yes. So there's been a debate, whether these should be done before or after. And a lot of that has to do with what the function is going into surgery. And I think that setting expectations are very important. So traditionally speaking, if you're very potent, you have no issues with ED going into one of these procedures, then it's safe to assume that you may have mild ED afterwards. Conversely, if you're entering into surgery with already some substantial component of ED, then it's likely that you may leave needing an implant or ICI or some sort of advanced therapy. That result is not guaranteed. So one of the things that I as a provider would not recommend is having one of these things placed beforehand if you don't need it otherwise. So if you're taking Viagra, you're taking Cialis, you're getting a good result with that before one of these prostate procedures, I usually just advise see how the chips fall, see what your function is afterwards. There's no ill or adverse consequence to having this done later. The only thing to note is that if you're having issues with ED immediately after one of these procedures, you want to be pretty aggressive about this, because men that let this problem go on for a very long time can develop some degree of atrophy of the penis and permanent shrinkage. If you're aggressive, you know about the risks of these things going into one of these procedures, and you're monitoring and you're following up with your healthcare provider, that's less of an issue going forward.
Certainly. Alrighty. I believe that answered our next question as well, which is going to talk about the optimal time frame post prostate removal to get an implant. So we basically covered that there. We'll move along to our third question here. So how long after prostate removal surgery should one try pills or injections before considering moving on to the penile implant surgery?
So again, that's a little bit of a conversation of what your function was going into it. So let's just take a man who has no ED whatsoever, and they go into this process. We usually advise immediately after surgery to begin some sort of erectile therapy. We call that penile rehab therapy. That's something that usually takes place immediately after the prostatectomy. That usually involves a daily oral medication, a daily Cialis, or a daily Viagra. And I will often have my patients use a vacuum erection device, because in the event that you're not getting good erections, using the vacuum erection device will allow new blood flow to cycle the penis. If you look at the literature on recovery of erectile function after either prostatectomy or radiation therapy, they're usually roughly about the same. They're usually between, at most, 2 years of recovery. Now, in my practice, I have found that most of the spontaneous healing to the erectile mechanism occurs after 1 year of healing. But I have individuals that, for example, maybe entered into their prostate cancer journey with very poor erectile function to begin with. And so I'm more aggressive about those patients. In general, I'll start to bring up the conversation of an implant no sooner than about 6 months after the prostatectomy.
Alrighty, perfect. Next question here. Is there any difference in recovery time between the pump model and the malleable implant model?
They're roughly about the same recovery, because they both use a single incision at the same area for the same amount of time. Where they vary is in terms of the recovery is because when you have only the implants put inside the penis, there's a shorter recovery for that because they're contained within those deeper penile structures. Most of the recovery is usually from swelling that occurs in the scrotal compartment where the pump is placed. So the more components that are placed inside the scrotum, which is the pump, the more that there's the likelihood for more swelling because there's been more manipulation in that area. So I tend to find that individuals that have a malleable implant will start to use them sooner, in about a week or two, maybe sooner than an inflatable. But it's really only a difference of about a week or so.
Alrighty, and running up to our final question with the implant procedure, can you talk a little bit about the size, I guess, before and after? Does someone lose penis size, and what about sensation as well?
That's a great point. So to tackle the second part of that first, all of the compartments of the sexual cycle are all individualized. So the neurologic pathways that govern erections are different from the neurologic pathways that govern sensation, which is different from that of the feeling of orgasm, ejaculation, and et cetera. So they're all individualized things. So when you put in a penile implant, or for that matter, if you were to use injectables, it's only going to give you an erection. The sensation's unchanged. After prostatectomy, you'll have dry orgasms. That's unchanged as well. All these treatments between the injections or the implant, they only seek to achieve the erection. The rest is on you, so to speak. In terms of expected size, that is a function of a number of different things. So as I alluded to in one of the prior questions, if a man who unfortunately is not well educated in terms of these treatment options, is not aggressive, and they've gone years and years and years without having good erectile function, that can cause permanent shrinkage of the penis, and that's something that is largely an irreversible process, which can account for differences in the size. Now, the intracavernosal injection will give you your natural erection, but with the mechanical erection that's generated by the implant, it's by what we call stretched penile length. So the way that the implant is placed into surgery is your penis is taken and then it's stretched for as long as it can possibly go, and then the implant is fit to that size. So the right expectation to have is if you were to take your penis as you have now and pull on it as far as you can, as high to the sky as you possibly can, that's going to be what the penile implant is able to achieve.
Very good. I've definitely heard that analogy before as well. We have one more quick question we're going to ask about ICI, because we just covered a lot of implant questions. So will ICI work for someone with venous leakage from a prostatectomy?
A great question. The answer is yes and no. Venous leakage is a particularly troublesome issue. I spoke earlier in terms of the etiology of vasculogenic ED, that it could either be an inflow problem or an outflow problem. It really depends upon the degree of venous leakage. So when somebody undergoes a Doppler study, and that's a situation where the penis is injected with trimix or bimix, et cetera, and then the practitioner performs an ultrasound evaluation where they're able to see the pressures of the inflow mechanism, but also the resting tone of the vessels to see what the backflow is. If you're able to use an injectable dose that's high enough to bring enough blood flow into the penis that then can cause compression of those vessels, that can sometimes help with a mild degree of venous leak. If the degree of venous leak is moderate to severe, then unfortunately probably the injection won't be able to overcome that. However, in individuals that are motivated to avoid an implant, I have often had them do injections with the use of a penile constriction band. So the injection will allow, as long as the arterial input is not damaged, it will bring the new blood in, and then by using a constriction band on the base, that will act to augment the trapping especially in the case of a venous leak. And I've had good success with that. And so that's one way to try to combat that, even if you're motivated to avoid the implant, but the injection might not be powerful enough to overcome a more severe leak.
Thank you, Dr. Amend, for taking the time to answer those questions. Now let's hear from someone who has been through the process of receiving a penile implant.
Hello, everyone on the call. It's a pleasure to be here. As mentioned before, I'm a patient educator. My name is Bob Thomas. I'm one of 5 patient educators, actually, for Coloplast. And what you might ask yourself, what the heck is a patient educator? Well, a patient educator is someone who has been through not only the experience of a surgery and a penile implant, in my case, but also a patient who has been through all of the various stages that were referenced in the doctor's presentation here tonight, including going from pills to injections to ultimately a penile implant. So there's a whole story in and of itself around that. Patient educators are not medical people. We're not people that are going to give you medical advice, but we are people that can be a resource for you if you're thinking about an implant, if you've had an implant and have questions about comparing your experience prior to surgery and after surgery with mine or one of the other patient educators, or if you just want to hear any perspective from a patient standpoint regarding this whole process and penile implants. Again, we're not doctors, so we can't dispense medical advice, and we certainly will not do anything to try to sell you on any decision one way or the other. We're here basically as a resource to answer questions. And I would say I talk to an average of about half a dozen patients a week. Most of them are facing into the decision and have made the decision or planning to make the decision around having an implant. Many of them, however, are people that have had the surgery and say, hey, I got this now and I want to compare notes with you. So either way, we're certainly available for that. My contact number and my email are there. If anybody wants to talk to me about anything relative to a decision you're trying to make, please don't hesitate to text me and we can set up a time and go forward. I'll be in the 5 to 7 minutes I have here, I'll try to be relatively brief, but also try to cover some of the bases that we covered before from a personal perspective. So talk a little bit about how I came to have ED, what my treatment options were, my reasons for going to a penile implant, what my surgery and recovery was like, and how I feel about it now, 2.5 years later. So I joke to my wife that I might be in my early 70s, but my penis is only 2.5 years old. So we got to share that with you. As mentioned, I had prostate cancer, and I caught it early stage, so I basically had all of the options available to me. The field was wide open, and I wound up opting for radiation treatments, a series of 28 of them. And I did that because I was really trying very hard even then to avoid ED as a result. And I thought radiation might be my best option. And you know what? For a while it was. Actually, for the first year or so after my radiation treatment, I thought I dodged the bullet. But then eventually ED set in and it became increasingly significant. And I did the usual track that perhaps many of you are on this call, and that's I started with Cialis or Viagra. I went with Cialis daily dose at first because that seemed like the least hassle. I didn't have to worry about when I would take it. And for a while those worked, but even when they worked, there was always anxiety about when they wouldn't work. So, and there was certainly the fear that I don't want to start something I can't finish. And so that was always in the back of my mind when I used them. And eventually they, as I said, worked until they didn't work. I progressed from there to Trimix, and the Trimix worked really, really well. And I was happy with it up until the time that I probably overdosed myself and wound up in the emergency room with the infamous erection lasting more than 4 hours. And while I was there, a doctor, one of the emergency room doctors, said, "You ought to look at penile implants." And I had no idea what they were at the time, and so my first reaction was, no, I don't think so. I guess I had this mental perspective of an erector set or something like that. But once I started looking into them, I realized that, hey, this could be the solution. First of all, it takes away all of the need for pre-prep. Whether it's pills, you have to remember to take them. Whether it's shots, you have to. Even I travel a lot on business. You have to remember to take it with you. You have to keep it refrigerated. All the things that the doctor mentioned. And so I looked at the penile implants, and they looked like they had a very high satisfaction rate. All of the literature I read indicated that the satisfaction rate was as high as 98% for patients, and just as importantly, or perhaps even more importantly, that satisfaction rate was just about as high for their partners, which of course is very important and one of the reasons why we're all doing this. And so, again, I did a lot of research, but it was really what did it for me in terms of tilting me in the direction of a penile implant was some words that were mentioned in the previous presentation. One, spontaneity. I didn't have to worry about when or how I could achieve an erection or for how long. And convenience. Again, nothing to carry with you or worry about taking at the right time or anything like that. And so after a great deal of deliberation and also a couple of consultations, not only with my prosthetic surgeon, but also a patient educator, someone like me, I ultimately decided to have the implant done. I think my surgical experience was probably very typical. They all vary somewhat, but I think my trajectory was pretty typical. I had the surgery as an outpatient. You had in the hospital and out the same day. And for 2 weeks, I went home and basically just iced. And I'd recommend for anybody who has the surgery, frozen peas are the best thing to use when you're icing. They're malleable and work extremely well. But icing was very important, and I took occasional Tylenol. But even though they sent me home with some stronger pain meds, in my case, I never needed them. I would take the occasional Tylenol if something got a little painful in the first couple of weeks, but there was nothing that I would call a deal breaker in terms of pain. At 2 weeks, I went in for my first post-op exam. Basically, that was just to check out and make sure that everything was looking good, and all the vital signs were looking good. At that point, no sign of infection or any of those risks. So at 4 weeks, I came back for my second post-op, and that's when they started show me how to cycle it. Cycling is basically making yourself erect for at least 20 to 25 minutes a day, and then deflating yourself. And it performs two purposes, one of which was you learn to use the device, which isn't very hard. I found that to be pretty easy to learn. And I'm not a doctor here, so the doctor might correct me, but I think it's also important to start stretching the tissue, and we're exercising the tissue. That's healing at that point. Anyway, they said cycling was really, really important. And so I was really, really diligent and did that every day. In fact, and continued to do that, I'd say for about 4 months after surgery. At 6 weeks, I went back for my follow-up appointment. And actually, it was my last appointment because they said, unless something happens, you really don't you don't need to come back. And by the way, you're good to go. You can resume sexual activity and whatever you want at this point, and which I did, and we did. And I'm not sure how long the residual effects of the surgery, the occasional pain after sex, or the things like that, just little soreness. I'm not sure how long that lasted, but I think for the most part that was all behind me within 3 or 4 months. But the important thing is I was back to and my wife and I were back onto a normal sex life 6 weeks after the surgery. So as I say, I talked to a lot of patients who've had this surgery, and I think that tracks pretty well with the majority of the cases. There are outliers, but in my case, in terms of who I've been exposed to, not very many. The final thing I'd leave you with is when I'm asked, would you do it again? My answer for me personally is not would I do it again. I wish I'd done it much, much sooner. When I think about all the time I fooled around with pills and the other remedies when this was available, I really think, boy, I could have done it sooner and had a more rewarding life. And I started to say sex life, but sex is an important part of life, but it's not all of life. And I can't say enough how much this did for me, not only physically, but also did for me mentally and emotionally. I believe that was referenced earlier too, but it's a very important point to make. So that's my story.
Thank you for listening in to this episode of For the Good of Man podcast. We hope the conversation with Dr. Amend and Bob helped answer some of your biggest questions around penile implants, what they are, how they work, and why they can be life-changing for men dealing with erectile dysfunction. If you found this episode helpful, be sure to subscribe and share it with someone who could benefit from hearing it as well. Until next time, stay informed, stay confident, and remember that real solutions start with real conversations.